Good afternoon, and thank you for joining us. My name is Tina Tebow, and I will be your moderator for this afternoon's news conference. Joining us today, the Honourable Stephen McNeil, Premier of the Province of Nova Scotia, Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina, and good afternoon, everyone. Dr. Strang will now give us an update on where we stand with the cases of COVID-19.
Thank you, Premier, and good afternoon, everybody. Today, we're announcing 5 new cases of COVID-19, bringing the total number of confirmed cases in Nova Scotia to 127. Until now, cases have been connected to travel outside of Nova Scotia, mostly outside of the country, or to a known case. However, public health has now reached a point with one of our cases under investigation where there are no direct links to travel or to a known case. So we must conclude that at least with this one case is the result of community transmission here in Nova Scotia. I'm just going to unpack that a little bit. So we know that the individual, this is the individual that we thought that was a potential exposure at a St. Patrick's Day event. As we followed up that community event, everybody in that event has been tested. They're now past their 14-day period. Nobody's become sick. We've also talked to them about where they may have traveled, and none of them had any travel history. So our only conclusion can be that the individual who attended that event, who has now been known as a case of COVID-19, must have been exposed somewhere else, and we can find no evidence of any links to a known case or to travel. So we have the conclusion of the first case in Nova Scotia where it has to be exposure somewhere within Nova Scotia. There may well be others. This should not surprise anybody, and we certainly expect to see more of these as time moves along. To me, what this means is hopefully to everybody emphasizing the critical importance of all we've been saying for the last several weeks. Strict adherence to public health orders and directives, practicing good hygiene, maintaining physical distance of 2 meters or 6 feet, limiting essential gatherings to no more than 5 people, staying at home as much as possible. It's critically important now that even if we have clear evidence of some transmission in Nova Scotia, the way we will minimize further transmission is all of us adhering to those public health orders and directives. It's important to know that, as I've talked about the last few days, we are actively looking at and have expanded our testing. So we are not only just looking for people with travel history. In a number of ways, we are actually looking for or to test Nova Scotians who do not have a travel history. At the same time, we've significantly increased our lab capacity, and in the last 24 hours, the lab at the QE2 microbiology lab tested over 600 tests in the last 24 hours. It's important that people understand that our directive around social gatherings of 5 or less is not a directive to gather to continue to socialize. That is a directive to get together in 5 or less if you need to do that. It's not a nice to do. We can still get together as long as there's only 5 of us. It's only getting together if you need to get together, and if you do, then it has to be 5 or less. Still getting stories from yesterday about, and I've had a number of emails sent to me today asking about, can we clarify, because people were getting together in somebody's backyard, sitting 6 feet apart, but there were 6, 7, many more people than 5. I live in Fall River. I saw the parking lot at the Fall River Tim's full of motorcyclists. It's a favorite place to motorcycle and stop at Tim's when spring comes, but they're still standing around less than 6 feet apart, talking and sharing coffee. We need to stop this. People need to stay home, stay away from each other as much as possible. You can, if you're social distancing, as we've heard, walk in your community, but walk to exercise, not to socialize. You should only get together in social groups of 5 or less if it's absolutely necessary. It's really important that people understand this, because this is how, if you're less than 6 feet, if you're more than 6 feet apart, the virus cannot spread between one another. It's critically important that people understand this, especially now that we have some evidence of transmission within Nova Scotia. Today, the Nova Scotia Health Authority released a statement of a possible exposure in a restaurant in Elmsdale. and public health has followed up a number of people who have been identified as potential close contacts, but they were concerned that there may have been some other people. This restaurant was operating on takeout on March 23rd and 24th, and they wanted to make sure that people who may have symptoms and had been at the restaurant getting food during those 2 days were made aware, and if they do have symptoms, is to then do the online assessment and call, and then go to 811 as directed. Unfortunately, people are then hearing some people targeting that restaurant. We have to understand this is not about the restaurant or the business. It just happens to be a place where possible transmission could have occurred. So when we do those public announcements, please do not use those as a way to target any business or an establishment or an individual. It's simply a way, as we've talked before, sometimes public health has to reach out publicly to notify the public about a place where they may have been exposed. But that does not give you a reason to target any group, any individual, or any business. I want to give an update on where we are with our long-term care facilities. As we said yesterday, we now have 3 long-term care facilities where we've had workers identified who tested positives. In 2 of the long-term care facilities, we have tested residents and staff, and the results that we've gotten back so far have been all negative. I need to correct. Yesterday I said everybody in the RK McDonald facility in Antigonish, all the results were negative. It turns out that there's a small group of workers or staff in that facility who their tests weren't processed yesterday. They are now being processed today. But in the facility in Antigonish, the one in Dartmouth, all of the tests so far have come back negative. We have a third facility in Enfield where, unfortunately, we now have 2 residents and 2 staff who have tested positive. Public Health is working actively with that facility, with the administrators. There's a complex interaction between staff and residents in that facility that we need to work through carefully to understand who may have been exposed. We are deploying, EHS now has a mobile testing capacity. We are deploying that to this facility, so every resident and every staff member in that facility can be tested. We'll be making that as a priority for those tests to be run in the lab. Any residents who are test positive, including the 2 that we know of, are being isolated in the facility. Any staff members who are test positive will be off in self-isolation for 14 days while we monitor them. We are working, the Department of Health and Wellness and the Nova Scotia Health Authority are working closely with this facility. This situation is causing or creating significant staffing issues, and we are supporting that facility to ensure that the residents get the necessary care that they need through this time. We'll continue to monitor this situation, but I think I want people to understand that we make long-term care facilities are a priority, and we have active processes in place to rapidly support long-term care facilities when they do become identified as potentially having COVID-19. I'll wrap up by saying that unfortunately we are seeing some firsts in Nova Scotia. Our first indication of community spread, the first indication of residents in a long-term care facility who have been infected. Again, these highlight the critical importance of all the public health orders and directives that people need to follow. They highlight, as I said yesterday, this is a serious disease that we all need to take seriously, and we need to do the things we can all do together to protect each other. By doing it in a way that cares for each other, that builds community, not tears down community, and uses common sense. That how do you apply our rules? You need to use your common sense and figure out what can I do to make sure that I'm minimizing the chance of me being a spreader here in Nova Scotia.
Thank you, Dr. Strang. I like your comment of use this as an opportunity to build community and have us come together. I want to thank those many Nova Scotians who are working very hard to flatten the curve by staying home and following public health orders. I know this has not been easy on our children who are out of school, not able to see friends or play at recess. But we are going to have to keep you out a little longer. Today we're extending our school closure till May 1st, and then we'll assess it after that. Effective immediately, all school trips that were planned are canceled. All exams are canceled. Grade 12 students who are on track to graduate will still graduate. This is not the final year you would hope for, and for that, I am sorry. But rest assured, we are focused on you and making sure that you graduate and that you have what you need to start the next chapter of your life. Those on track to move to the next grade will still move. Students who need this term either to graduate or to grade will not be left behind. Your success matters, and we are not going to turn our backs on learning. Today we are introducing Nova Scotia's Learning Plan. This plan offers e-learning options for students as well as at-home educational options for those without internet. It will be led by our teachers and our principals with the support of our regional centres of education and CSAP, our French school board. This week, teachers will be reaching out to students and families to determine a plan that works best for you. In the meantime, you can visit our website, curriculum.novascotia.ca, to assess daily plans, reading tips, and lesson ideas for students where students can learn effectively at home. We're adding additional hours to our Homework Hub, a free online service that connects high school students with math teachers. And we will continue to provide additional supports to members of our school community through services such as Schools Plus. Students without internet access will receive bi-weekly at-home work packages. We understand many families and teachers are under great pressure. This learning plan is meant to help you and your children, not to add additional pressure to your lives during this difficult time. For families who believe that this at-home learning is an added stress, I encourage you to reach out and speak to your teacher. No student, no child should be penalized because of COVID-19. We will now be happy to answer any questions you may have.
We'll now go to questions. Again, just a reminder, we'll take one question and one follow-up from reporters on the phone in the allotted time that we have. Again, please ensure that your phones are on mute. We'll start with Samantha Long from All Nova Scotia. Go ahead, Samantha.
Hi, yes, Helen. I'm just inquiring about the rent deferral program and the criteria. It looks like it's for employees with 5 or more. It's for workplaces with 5 or more. And I'm wondering how the government arrived at that requirement.
No, that was the original. We've heard from businesses that has been adjusted downward. That will not apply to the rent deferral. I want to be clear, and I appreciate the question. This is for those businesses that have been closed. All of those businesses out there today who can pay the rent, pay the rent. This is an opportunity for landlords to work with their tenants whose businesses have been closed or shut down because of COVID-19. We're looking to have that deferred over the life of that lease. Which means that at the end of 3 months that the tenant won't end up with a 3-month bill for rent. We expect the landlords to spread that over the life of the lease in an arrangement that they can work out. What we have said is that for doing that, we'll ensure that if a business ends up in trouble in a few months or 12 months from now, that we would cover the 3 months of lease that was that we've asked them to work on the deferral for.
Samantha, go ahead with your follow-up if you have one.
Thanks. Yeah. So to clarify another point, the list or the original list I saw didn't list any retail businesses. So will they qualify under the rent deferral program?
Yeah. What doesn't qualify are franchisee models from across the country. What we're trying to get at here are Nova Scotia-born companies that have been growing here to ensure that we can get them through this period of time. So that they're either not evicted in this period of time or that they can make arrangements with their landlord so that when we see our way out of this, that they will be in a position to recover and build an economic future for themselves.
Next, we'll go to Shayna Luck from CBC. Go ahead, Shayna.
Hello. This question is for the Premier. And regarding the schools, how do you distinguish between someone who is on track to graduate and someone who's not on track to graduate, particularly where, you say, exams are canceled?
Well, that would be determined by the educational experts, our teachers, our principals, working with the department. As you know, there's already been a number of programs and exams that had happened in the first term. Some work had happened. And for those that are in grade senior high, and these work programs that are happening now will be part of that process. There just won't be an exam associated with it. They've also worked with our post-secondary institutions when it came to those who are graduating and acceptance into university. That has all been worked out through our partners.
Go ahead, Shayna, if you have a follow-up.
Yes, for Dr. Strang, regarding the nursing homes, long-term care homes, I'm wondering what lessons have public health officials learned from what happened in other provinces, like at the Pinecrest Nursing Home in Ontario and the Lynn Valley Care Home in BC? How can those help people here who are trying to cope with the cases in our nursing homes?
So I think we haven't had time, I'll be honest, to get a detailed breakdown of the response in any nursing home across the country. I mean, everybody's involved with responding to this event, and over time we'll be able to have the luxury of a lessons learned. But I think we have a lot to build on across the country, because we work with our long-term care facilities every year for influenza and being prepared for influenza outbreak. So that gave us a very good starting point in our relationship and what's in place with long-term care facilities. I think the things we put in place here in Nova Scotia a couple of weeks ago, really trying to protect our long-term care facilities around by stopping visitors, stopping day trips. All those things were they problematic for some people and caused some disruption, were absolutely necessary. So I think the steps we've taken to answer your question directly here in Nova Scotia, knowing what we knew about the virus and the way it could be transmitted into a long-term care facility, and the work we're doing now responding to long-term care facilities is very much built on the work that we do with them every year around outbreaks of influenza.
Next, we'll go to Jesse Thomas from Global. Go ahead, Jesse.
Great. Thank you. This is a question for the Premier. Good afternoon. Looking at the rental deferral program, several small businesses are saying this isn't going to help them, and kind of compared their situation to kind of, revenues coming in. They're on a month-to-month basis, and essentially they say without direct support for them, monetary-wise, the issue is just going to compound itself. If they ever get back up and going, they'll be forced to pay, more and more rent at that time. How are we going to address this? There's several small businesses that are sending a petition around.
Well, this is one aspect of how small business across our province can receive support. This is meant, quite frankly, to take the pressure off them right now. They can work with their landlord to spread that over the life of their lease. That could be 2 years. If it's shorter than that, then the landlord would have responsibility to extend it beyond that period of time. But there's been a perception out there that in 3 months from now that every small business in the province is going to end up with 3 months of rent. That is not at all the genesis or the idea behind this. This was to ensure that landlords walked in and treated their tenants with understanding. The fact that there has been their revenue has been cut off, that they need the ability to get up and get started. They need them to get their business and clientele back together. And in order to do that, they need to be able to spread out some of these expenses over a period of time. And that's what the issue around the deferral of rental was all about.
Go ahead, Jesse, if you have a follow-up.
Thank you. My follow-up will be directed at Dr. Strang. Good afternoon. I guess as we're seeing the advent of community spread, I'm wondering how many cases right now are still being investigated for community spread, if there are any at this point, and just wanting to confirm what this says for the numbers that the province is reporting. If there's community spread now, do you think the numbers might be 2 or 3 times higher than what we're reporting?
So we have a handful of cases. I can't give you a specific number, but a handful, a few that we know that are in the stages of their investigation, and we haven't finalized things that to be able to make a definitive conclusion on where the exposure was. I can say that the 5 new cases that came to our attention in the last 24 hours, they have been followed up, and in 4 of those 5, it's related to travel. So the vast vast majority of our cases still remain related to travel or contact with a known case. We're just saying that now we have at least, when I have a case where we can't make that conclusion, and then therefore the only conclusion, it must have been somewhere here in Nova Scotia. As I've said in previous briefings, we have continued to do our influenza surveillance because we're still in influenza season, but we're looking for indirect measures as well of significant clusters of respiratory illness. So we monitor on a daily basis the percentage of people going to an emergency room anywhere in the province with flu-like illness, and we're not seeing anything happening in that surveillance out of the ordinary than what we would normally see in a flu season. We do monitor outbreaks in group settings, and we have had a couple of outbreaks of respiratory illness in long-term care facilities which are not COVID, but where there are some other common respiratory virus. So we every time we see that kind of cluster, we make sure we test for COVID. We're testing people who are requiring to be in hospital or go to hospital for COVID. We're not seeing positives from that. So I think all our surveillance would say that even though we can't say there's no additional cases of community spread, we're able to say that there's no indication that is substantive at this time. We certainly know, looking across the country and globally, that in Canada, on all jurisdictions, the introduction into Canada and provinces and territories was from travel, and it remained travel for a long period of time. And now in our larger provinces, BC, Alberta, Ontario, Quebec, that are 2 to 3 weeks further ahead in this than we are, they are now seeing substantive community spread. As I said previously, we are actually fortunate because we're 2 or 3 weeks behind where they are. We are implementing the strong measures at an earlier stage in our epidemic here in Nova Scotia. So we actually have a greater chance to limit community spread by having everybody adhere to those measures right now. But that's why I made my remarks earlier today. It's critically important that we understand that the way we limit community spread in Nova Scotia, even if it may be small at this time, is all of us sticking with the public health orders and directives. And it will take a number of weeks. But if we do it well and do it together, we can make a substantive difference by minimizing the spread of COVID within our communities, while at the same time we continue to focus on returning travelers, isolating them, getting them tested, making sure they're staying away from others.
I think it's important that public health, under the leadership of Dr. Strang and his team, changed the direction in many, probably ahead of most Canadian provinces, when we started looking at close contacts and aggressively going after close contacts out in the community. And even if they are a negative test, they are isolated and continue to be checked up on by public health to ensure that it doesn't show up. We started that ahead of many Canadian provinces. We moved away from travel being one of the issues on 811. We've broadened out the testing from, not only in the way we do it, but from 200 a day to we've been in, above 800 on some days. Let me tell you, we are aggressively going after any opportunity that we can find to do those tests. And we need Nova Scotians' help, quite honestly. We need you to do what Dr. Strang and Public Health have been asking you to do. When you come into our province, go home. Whether you're driving across the border, whether you're coming from within inside of Canada, or whether you're coming from abroad, we need you to self-isolate at home. That's the best thing we can do to prevent any community spread.
Next, we'll go to Keith Doucette from the Canadian Press. Go ahead, Keith.
Yes, good afternoon. Dr. Strang, I just want to pick up on that again. We've had a couple of milestones today in the Atlantic region with the first death in Newfoundland, and now community spread established in both New Brunswick and Nova Scotia. Given what you said off the top in terms of anecdotal evidence of people not listening about gathering in large groups, with the emergence of this first community spread case, based on what we know, is it likely we're going to have a coming wave, despite what you said in the previous answer, in terms of more cases due to community spread?
So I expect we're going to see more cases related to community spread. You have to understand that as we deal with this, and the cases we see today are the exposure happened a week to 2 weeks ago. There is that 14-day incubation period. Most people, within about a week of being exposed, come down sick. Sometimes it's longer, up to 2 weeks. So the cases we see today, their exposure didn't happen yesterday. It happened 1 to 2 weeks ago. So we're always at a bit of a lag. And so we will see, we've been incrementally putting in stronger measures. It does take that week to 2 weeks of a time lag before you see the impact of those stronger measures. And Dr. Tam, our National Chief Public Health Officer, was talking about this last night, that the next 2 weeks are a critical period because it will really start to show across the country as we really instituted stronger and stronger public health measures over the last couple of weeks. It'll be the next 1 to 2 weeks where we see the impact of those. My hope and the real appeal and plea to all Nova Scotians that if we are doing what we need to do and have been doing that well, and we need to do a better job in the coming last week and in the weeks that we're entering into, we will see a less dramatic rise in the number of cases than if we're very lax about this. If we don't do the things that we've been talking about, we will continue to see an increasing number of community cases in the weeks ahead. But if we do well what we've been talking about for the last couple of weeks and do it all together, what we will see is some more cases, but nowhere near the dramatic rise in those cases. And if we're continuing to combat community transmission, that is the way we get out of this the fastest possible. And I want to emphasize that point to people. I understand the disruption to people's lives. I understand the disruption to the economy. But if people are unhappy and frustrated by that, the best thing you can do to get out of this situation as fast as possible is to do what we're asking and telling you to do. If you keep being lax about this, we just keep having more opportunities for community to spread, and this goes on and on and on and on. So even if you may not like it, the best way to get yourself out of that situation is to do what you're being asked and told to do.
Go ahead, Keith, if you have a follow-up question.
Yes, it's for the Premier. It's along the same lines. I'm wondering about the death in Newfoundland and Labrador, what you think that Nova Scotians should take from that, given that we haven't had deaths in the region prior to this.
Well, first of all, on behalf of all Nova Scotians, we want to send our sympathies to the family of the person who's succumbed to this disease. I think what it should tell all Nova Scotians is this is real. We've been hearing about deaths in other parts of the country. This is in our neighborhood. This is on our front doorstep. Dr. Strang has been very clear. This virus kills people, and it's also in our hands. We have a choice. We can take the steps that were put in front of us, self-isolate, wash our hands, keep distance, stay out of long-term care facilities. If you're not feeling well, look at the online tool. If it directs you, call 811. We can test you and isolate you. This is as tragic as it is. We need to realize that what we've been told is that this virus actually will kill people, and it is happening in our own communities. And I can't stress this enough. It's why the frustration boils over at times. When you hear the evidence and you see the evidence of what this virus can do and how quickly it can do it, when we see people just going out and deciding they're going to get in groups of whatever, because they think it's their right. Well, what about the rest of us? What about ensuring that we can actually get control of this virus and begin to keep our families safe, keep our communities safe, allow us to start rebuilding our economy, allow us to get back to some life of normalcy? And if there were people who are listening to this who didn't think this was real, they now have a case in Atlantic Canada where a family tomorrow will be continuing to mourn the loss of a loved one because of this virus. I don't want any of us to have to do that.
Next, we'll go to Nicole Monroe from the Chronicle Herald. Go ahead, Nicole.
Yes, thank you. This is for Dr. Strang. Just looking at a new study that came out of China looking at the incubation. They are saying that incubation can sometimes seem longer in the cases that they looked at, up to 20 days. So are you considering extending the self-isolation past the 2 weeks for Nova Scotians?
So no, in any disease like this, there's always some exceptions. But certainly my understanding of the epidemiologist, the way it happens, and certainly the discussions I'm involved in nationally, is that it's very clear that the vast majority of people become sick generally around the 5 to 7 day mark. There may be some people that go up to 14 days, and there may be the very odd person who goes beyond that 14 days, but that is by far the exception, and that's not an indication that we need to go beyond the 14 days in terms of our strong measures around controlling this disease.
Go ahead if you have a follow-up, Nicole.
Okay, thank you. This one's for Mr. McNeil. Just looking at how many people, like you said, Nova Scotians that aren't listening at this time to public health officials and everything like that. A lot of Nova Scotians are listening, but others aren't. Are you considering, I know that you implemented telling law enforcement to proceed with fines, but are you considering any other harsh punishment or restrictions on Nova Scotians to help prevent community spread?
Well, first of all, the vast majority of Nova Scotians are respecting what public health is asking them to do, and I want to thank them for doing so. Yesterday, the Attorney General instructed law enforcement across our province to move from an educational component to enforcing, which means ticketing and towing of vehicles. We know that is happening, and we want that to continue to happen, quite frankly, for those Nova Scotians who continue to blatantly ignore the order that's been put before them. This is about public safety. This is about ensuring that we as a community can control the spread of this virus. And as I said yesterday, and for those of you who choose not to follow the public health orders, then police will force you to follow them.
Next, we'll go to Cassandra from Radio Canada. Go ahead.
Good afternoon. So this is for Premier McNeil. Do you think there could be delays, or should we expect the school year to end in June as usual?
We're working with our partners, and I want to give a shout out to the Nova Scotia Teachers Union and our partners in the education system. We've been working with the Deputy Minister and the Minister to find a collaborative way forward. They've all been focused on students and kids. That's what this should be about every time when we talk about education. It should be students and kids. We're, in the midst of difficulty, you always find a bright light. I'm looking forward to following what this e-learning looks like, potentially provide new opportunities for us to take lessons out of this into the next school years and years beyond. But we'll assess this in May 1st. Teachers are committed to this. Teachers across this province have been concerned about their students. They know them well. They know how they're doing academically, how things are happening for them socially. If you follow online, many of them are very concerned about what is happening with their kids. So this will give them an opportunity to stay connected with them, and at the same time gives us an opportunity for learning that we want to continue throughout the remainder of this school year. But in terms of what happens after May 1st, we'll assess that as we get closer, and we'll include our partners.
Go ahead, Cassandra, if you have a follow-up.
Yeah, so this is in regards to universities. So are they given guidelines as to how to proceed with the rest of the semester, or are they responsible to decide on their own what they're going to do?
Many of the universities already decided they were doing distance learning. As we had said here many times, if you're a Nova Scotian student in a university here, please go home. Get off campus, get out of your dorms, go back to your home community. We know we still have students on there, but there has been studying that's been happening from a distance, and they're working their way through the remainder of this year in the curriculum. I think many of it will be paper as opposed to exams. I think some of them move to ensuring they have papers towards the end of the year that can be submitted. And I do want to thank our universities who have been working with the public education system, particularly for those in grade 11 and 12 who are making decisions about what their future will be in the coming years, to understand and work with them that the entrance next year or entrance into a post-secondary school wouldn't be impacted by the change that happened at the end of this current school year.
Next, we'll go to Natasha Pace from CTV. Go ahead, Natasha.
Hi there. A first question would be for the Premier. I'm wondering whether or not you are thinking about extending the state of emergency in Nova Scotia.
Well, that is has a couple of weeks, but I would say to you, we'll continue. It will be extended, as you know. It's a process issue that you can do one for 2 weeks, and then will have to be extended. But it's just been a matter of course. I haven't even thought about whether I should or shouldn't. Just waiting for the deadline, and it will be extended.
Go ahead, Natasha. If you have a follow-up.
I do. For Dr. Strang, I'm just wondering, I apologize, you did talk about this off the top, but it cut out a bit. Did you say that the case you believe is from community spread is linked to the St. Patrick's Day party in Lake Echo? I'm just wondering if you can be clear about that particular case that you believe is community spread.
Yeah, what we know is that the individual who was tested positive as a case of COVID-19 was at that St. Patrick's Day event, and so our initial thinking was that maybe that was where that individual was exposed and became ill, or how he became ill. But as we've investigated that St. Patrick's Day event, nobody else there has become ill. They're all past their incubation period. They all tested negative. As far as nobody had kind of travel history, so we can conclude that St. Patrick's Day event was not the source of this individual's exposure. They must have been exposed somewhere else, and because of our interview with that individual, we know that they have not related to them traveling outside of Nova Scotia or being a connect with another known case. Therefore, we have come to the conclusion that they must have been exposed somehow through some chain of community transmission yet to be discovered here in Nova Scotia.
Next, we'll go to Chris Hallef from News 95.7. Go ahead, Chris.
Thank you. This question is for the Premier. A colleague of mine spotted a long line outside of the Cash Money on Friday. Now, we know payday loans offer quick cash but have greater interest and fees than other loans. I'm just wondering, is your government considering bringing in any regulations that would protect people from these high interest rates during this pandemic?
It has not been part of what I have discussed at this point, but I appreciate you bringing it forward, and I will have people look into it.
Go ahead with a follow-up, Chris.
Yes, this question is for Dr. Strang. I guess it's a little bit lighter, but I'm not sure if you're aware of the community response in Fall River, in particular, to your efforts, but residents have been putting up signs in appreciation of your help and guidance during this pandemic. I'm just wondering, have you seen this and what you think of it?
So I did actually, right in my neighborhood, and my wife and family, we went for a walk to exercise, not to socialize, last night. I need to take a little bit of break, and I did see those signs. I very much appreciate the response from my community, but I'm a little bit embarrassed by it because, as I've said before, I'm just here because of my job and the public face of this, but I'm representing hundreds and hundreds of people in public health and across the healthcare system who are not seen but are working 7 days a week extremely hard to protect Nova Scotians, healthcare workers who are willing to stand up and put themselves at some level of personal risk to be able to make sure that Nova Scotians who have COVID-19 are going to be cared for.
Next, we'll go to Jake Boudreau from the Port Hawkesbury Reporter. Go ahead, Jake.
Yes, this question is for Dr. Strang. It's come to our attention that an employee at a gas station here in Port Hawkesbury has been tested for COVID-19, and I'm just wondering if those results are among the results that have been received today. And I've also been made aware that the station in question is closed and will be closed until sometime this week. But in addition to being a gas station, it's also a convenience store and a depot for Maritime Bus. So I'm just wondering if you guys are aware of that situation.
So I'm not personally aware. I hope you can imagine that I don't get involved in the details of every specific case. I have a very competent team of regional medical officers of health support who work with very highly professional and trained public health staff who investigate each and every case. It's dealt with at the local level. And as I've said previously, we follow up each case. You've said this person is tested. We don't even know the results. But if they become become positive. Each case is followed up, and all their close contacts are identified. If somebody tested negative, they're still followed up by public health and given appropriate advice. And if there's a workplace or a business that's indicated as part of our follow-up that there may have been some exposure, appropriate advice is given to that workplace. We try to work as much as possible. We usually don't give advice that a workplace needs to be closed down, but some workplaces are going beyond that to take the steps that they feel appropriate to go further than public health advice, and that's their choice, and that's okay. I hope that answers your question. I mean, this is all dealt with in detail at the local level. I get information and can look at things from a provincial perspective and get more involved in very specific cases where there are perhaps some more challenging circumstances.
Go ahead with a follow-up if you have one, Jake.
Yeah, I'm not sure if it's a question or more of a remark. I guess the concern is, in addition to being a high-traffic area, it's also you have people coming from wherever, to take the bus and stuff like that. So I didn't, if there was a positive case or test result, would that business have to shut down?
So without knowing the specifics of the case, I can't say yes or no. I'll repeat, though, I have complete 100% faith and trust in the competence and expertise of the regional medical officers of health and public health staff and the health authority across the province to work with each and every case and make appropriate decisions to best protect the health of Nova Scotians.
Next, we'll go to Adam Cook from Tellil. Go ahead, Adam.
Thank you very much, Premier McNeil, Dr. Strang. Thank you, first of all, both of you, for making yourselves available for the press and available to Nova Scotians every day at this time. We greatly appreciate it on both levels. Premier McNeil, this might be a question better put to your Minister of Municipal Affairs, Chuck Porter, or to the Nova Scotia Federation of Municipalities. But I'm just wondering, this is around the time of year when many municipalities, municipal councils, would be entering into their own budgetary talks, and I'm just wondering, are the deadlines for municipalities to submit their municipal budgets to the province still going to be kept in place? Do you expect that there might be a need or any requests for any wiggle room in that regard, or is that something that you feel that can stay the same this year?
Well, first of all, I want to thank the municipal leaders across the province who've done a tremendous job of collaborating with Minister Porter and to their staff, who have been working in connection with government in all departments and all levels to try and to ensure that we keep Nova Scotia as safe as possible, and those administrative or governance issues that would come forward, Minister Porter would assess them if someone brings them in, but at this point I've not heard of anybody doing that.
Go ahead if you have a follow-up, Adam.
Yes, I do. Thank you. Just wanted to get a sense from you, Premier, again, on the municipal government front. Do you get the sense that any municipal councils anywhere in Nova Scotia are experiencing any difficulties in terms of being able to carry out their business or, collect tax revenue or any such thing as a result of COVID-19? Obviously, municipal councils have had to change the way that they hold council meetings, but in terms of just the basic business of municipal government, does everything seem to be rolling along smoothly there?
I think municipal governments will have to be like provincial governments and federal governments and private businesses when in this period of time that will have to be extra lenient with people who, for whatever reason, because of this COVID-19, has had their income stream impacted. They've lost their income. So I think people need to be understanding of that as governments and work with their ratepayers to give them the space and time that will be required to help them get through this very difficult time, this very stressful time, quite frankly, on families and communities and businesses. Work with them to try to lessen the anxiety they feel about a bill that may be coming, and work with them to be able to smooth it out over the long term.
Next, we'll go to Keora McKenna from the Coast.
Hi there, this question is for the Premier. I'm looking for clarification on the directive around no tenant can be evicted because their income has been impacted by COVID-19 the next 3 months. Does that offer any protection or include students whose student loans are about to dry up, or people on EI who are looking at the end of their EI and unable to apply again or qualify for the Canadian Emergency Response Benefits?
Well, I would encourage all tenants who are impacted, have their income stream impacted by COVID-19 to deal directly with their landlord. I've heard of many positive stories where landlords have been collaborating with those who have had that impact for them. So the number of the cases that you've mentioned would be determined. I know there's been lenience around student loans, have been impacted. There's been broadening around EI that's specifically been raised, where they've been extending it a bit based on seasonal work because it's doesn't start at this point. All of those things are with direct in mind to be able to support those individuals and alleviate some of the stress that they're feeling. But I appreciate the question because it gives me an opportunity to say to those of us in this province who can afford to pay our rent, pay your rent, please, on time. This is not an opportunity for people to stop paying their rents. That directive was for those who had lost their jobs or their income had impacted by COVID-19. Landlords are willing to work their way through that, but it means the rest of us who are still being paid have to pay our rent on time.
Go ahead with your follow-up if you have one.
And then I just want to clarify, I think you answered it, but people who are facing eviction then because the landlord is renovating the property, does that qualify under the same umbrella?
No, if there had been evictions that have been happening that for whatever reason before, those eviction notices would still continue. What we've said is the ones around COVID-19, if that's the reason for it, then we expect landlords to work with those tenants to see their way through this.
That's all the time we have for questions for today. Go ahead, Premier.
Thank you, Tina, and thank you, Dr. Strang. Today's education announcement may not have come as a surprise, but for students and families, it's still hard to hear. These are extraordinary times and that require innovation and cooperation, and we are focused on math and literacy. And I'm asking you, students and parents, to be patient with your teachers. They are learning too, and we are grateful that they are taking on this challenge. And for little ones, if you want to learn by having some fun, let's find a way. Learning comes in all shapes and sizes, and what matters most is that we stick together as families. You learn from each other, and you continue to love one another. And we will get through this. It's going to take all of us, though, working together. Today, Dr. Strang confirmed a case of community spread of COVID-19 in Nova Scotia. While this wasn't unexpected, it is unsettling and a giant wake-up call for us all. We must continue to follow the public health protocols. Stay home, wash your hands, practice physical distance rules at all times. And as the virus moves closer, we need to move further apart.